Good afternoon, everyone. My name is Diksha, and my topic is Garbhini Paricharya and yoga for healthy pregnancy. So, just a moment, my screen is not. Yeah, I would like to pay my gratitude to Nutan ma'am and the entire team of AYG Academy and my fellow mates. Um, Moving on. Okay, so we all have seen the movie DDLJ and we know how Raj and Simran ended up together happily. But picture abhi baki hai mere dost because Raj and Simran has just conceived and they are now confused on what to do after this. And their big question is how to get a healthy pregnancy. What is the roadmap for that? So the answer is Garbhini Paricharya. Thanks to our great acharyas of Ayurveda who have given us this science of Garbhini Paricharya, wherein they give us the guidance on how a pregnant woman can take care of herself during these 9 months to have a blissful experience. Now, this aims on three main factors. One is anupaghatam, that is to prevent injuries to the pregnant woman and her fetus. Paripurnaya, that is to support the complete growth of the fetus development in the womb. And sukha prasava is to have a blissful experience of the childbirth. Since it's about Raj and Simran, and DDAJ has to come into the picture. So their DDAJ is diet, discipline, lifestyle for joyful and blissful pregnancy experience. Well, starting with the first trimester, in the first month the muscle mass has panchabhuta in the unmanifested form. In the second month, the by the end of 7th 8th week of the pregnancy, the gender can be determined. By the third month, all the indriyas starts to manifest and the body part gradually starts blossoming like a flower. These are the signs, and the most common is the morning sickness and the nausea that a woman faces in the first trimester. And what hormones has come into the picture is HCG. It increases to a great level, which is why the women feel morning sickness and the nausea. So the Yaman and Niyama comes into picture also, wherein she should give herself a complete rest and avoid junk foods. Relaxance also increases, but to feel its effect can be felt if the woman is practicing yoga. So it helps her give release from the stress. With the drop of estrogen and progesterone, she feels a lot of weakness inside her body. So having folic acid and fresh fruits, milk and ghee is very important here. Coming to the second trimester of the pregnancy, the in the fourth month, the heartbeat starts beating, sense organs becomes predominant. In the fifth month, the muscle and vascular system gets more developed. Motor organs starts functioning, blinking and kicking, etc. happens. In the by the end of the 6 months, there is development of intellect, strength, baby's skin color, and reproductive organs of the fetus. Now, in the second trimester, the HCG is constant, so Simran can come back to her daily routine. Relaxants are increasing, and estrogen and progesterone are also increasing. So this gives her regain of strength. So she should practice good strengthening exercises, and having soaked dry fruits. Protein intake should be increased slightly because the baby is developing the vital organs. Folic acid should be continued, and because the baby is also developing the sense organs, so the stimulant food should be given here. So mother Simran would be experiencing a lot of cravings here, so that should be addressed. Now in this is since the sense organs have come into the picture for the fetus, so Garbh Samvad is something that can be practiced, wherein the Raj and Simran as a couple can have a connection with the baby by communicating with it. They can do chanting and meditation together. Nad yoga is another thing that the mother can go ahead, can practice. Visualization of the features and the characteristics that they want in their baby, reading books to the baby, and then learning. More focus should be given on learning new skills. We can take the example of Abhimanyu, how he learned to enter into the Chakravyuh when he was only in his mother's womb. right? So moving on to the third trimester is in the seventh month, majorly there is complete development and only subtle changes are happening. Mostly emotional development is there. And in the eighth week, it is a very crucial month, just like the first trimester, because there is a fluctuation of energy between the baby and the mother. So Simran should be more cautious in this week, in this month. And the last month is of the child birth, which is she can experience sukha prasava if she practices all these yamana and niyamas. Now, in the ninth month, in the third trimester, again, the HCG is constant, prolactin is constant. It would increase only after the childbirth. Relaxin is at maximum. This is important so that women can have a sukha prasava experience. For this, she can go have she Raj should be very supportive as a husband for Simran's need. And estrogen and progesterone are maximum because she needs lot of strength. And during this time, a woman experiences constipation. So food that promotes motion should be given here. And the kind of yoga that is recommended, 3S yoga model and couple yoga should also be first trimester. Stability should be given importance to. So to practices like chanting, yoga nidra, sukshma vyayam can be done. And in the second month, second trimester, there is more strength, so strengthening model should be practiced. In the third month, third trimester, there is spacing, because of lack of space. This more Practicing this model would create more space for the baby as well as for the mother here. Going ahead, inversions, backward bending, prone poses, holding of breath and jerky breathing, complicated poses, strong twisting, these all should be avoided in the yoga practices. Three important golden rules of this 3S yoga model is Yatha Shakti, that is practicing as per capacity, Shana Shana, taking it slowly and steadily, and Pran Shakti, that is to feel the energy when practicing the yoga. So to conclude, I would say that Raj and Simran are now clear about what they need to do. But there's a food for thought for all of you is that it takes a great village. It takes a village to raise a child. But what is your role in it? Thank you so much.